Back. There's no doubt that nurses are so important in the world of healthcare, and with the aging baby boom population, the demand for nurses is high. And joining us now to chat about getting a nursing degree and advanced programs for nurses are Jill Berg, the president of Columbia College of Nursing, along with Amanda Polcyn, a clinical nurse leader at Columbia St. Mary's. Welcome, ladies.
Thank you.
So let's talk a little bit first about Columbia College. Tell us a little bit about the College of Nursing and basic information, things we need to know.
Well, Columbia College of Nursing is the longest standing nursing program in the state of Wisconsin, and we currently offer an undergraduate nursing program and a graduate nursing program offering a master's as a clinical nurse leader.
And what makes that program unique?
Well, the clinical nurse leader is the newest specialty in nursing, and what it really does is it allows nurses to stay at the bedside while providing high quality safety and quality outcomes for patients, and it allows them to really take on a leadership role.
Okay, and what about the Master of Science in Nursing program? That sounds like something specific and unique to Columbia.
That's what the clinical nurse
That's
leader
what that
program
is. Okay, so Amanda, expound on that a little bit. What does that mean to be able to stay at the bedside and also get the safety, the whole gamut?
Sure. Well, to start with, I absolutely love being a nurse, but I found myself wanting to do more and being able to advance healthcare more. And when I heard about the clinical nurse leader role, it was the perfect opportunity to be able to still care for patients, which I adore doing, and continue to make it safer for patients and continue to improve the workflow for nurses at the bedside.
Obviously very good for you professionally also to
Yes,
have
it
that.
is.
So that is what a clinical nurse leader is. Then how long does this program take to complete?
It's an accelerated program. They can complete the program in less than 17 months. So our next cohort will be starting in the beginning of July, and they'll be graduating in December of 2018.
Do you have a lot of students that go straight from the bachelor program straight into the master program, or do they go out and work in the workforce for a little while and then come back and build up?
The program would be appropriate for either.
For either one. Okay, so it makes sense no matter what your goals are. So working and attending classes, this is obviously top of mind for so many. We need to be out there bringing the bread home. So talk about that a little bit. Can you do it?
I think Amanda can speak to that very well.
You've been there, done that.
Yeah, I can testify that it is definitely possible. Even with the accelerated program. I'll be honest, I was nervous myself about how to do it, but I was able to work full time, go to school full time, and actually be pregnant and have a child during the program.
Oh girl, you are busy.
I was, but it was all well worth it. So, you know, there's moments, but with any master's degree, any advancement in your career, there's moments where you have to put that first.
Sure.
But it's well worth it, and it definitely feasible. And I got such individualized personal attention from the instructors at the college that it made it even more possible.
So if there are any nurses watching now then who are thinking about doing the same, what would be your words of encouragement for them?
Do it.
Do it.
I mean, if you want to continue to advance healthcare and you want to continue to take care of patients and make a difference, this is definitely the way to do it. It has fulfilled everything that I wanted it to do to this point.
This is obviously going to be something that I understand less, not being in the healthcare field, but clinicals. What is a clinical? Are they part of the regimen? How does that work?
Well, mine was, the clinical is not what someone would typically think of as a nursing clinical. You are at the bedside, you are taking care of patients, you're put into what we call a microsystem. In my case, it was a unit in the hospital. You assess it and you find something that needs to be improved and you start working on the improvement itself.
Oh, wow.
And then that is a project that you work on for the time during your clinicals. And we did such a nice job that we had, two of us were actually able to present at a national conference after graduation. So,
my gosh.
Yeah, so it is pretty, it's totally doable. It's a great way to learn what you're doing on a day-to-day basis. And in my situation, it was a great way to integrate myself into a job that I have now.
So when you say advancing healthcare, you're not just doing that once you graduate from the program, you're doing that while you're in it.
Correct.
Absolutely.
You're actually, and I mean, it sounds like you're getting so much actual work experience at the same time.
Absolutely.
As you're learning, which is fantastic. So what are the requirements for admission then?
Well, they have to have a bachelor's degree in nursing and be able to articulate why they think this degree is right for them. This is a very unique degree, and hospitals that have adopted this specialty have found that there are improved patient outcomes, improved nurse retention, nurse satisfaction on the units, physician satisfaction. So it's a win-win, but you really have to have someone who is motivated to go in, do that constant environmental scan, identify what are some of the areas that we could possibly improve, do root cause analysis, look at best practices, and be able to implement those changes. So you have to have somebody who's really motivated
and
driven.
passionate.
Yes.
Clearly,
Yes.
you really have to love what you do. I think to want to advance it, to want to make changes, and differences in the way that healthcare runs. So that's fantastic. All right, so your faculty, obviously, top of the line, fantastic. You can learn more about them by going to CCON.edu. You can also call the number on your screen, 414-326-2330, to learn more about that particular program or just Columbia College of Nursing in general. So ladies, thank you so much for being here.
Thank you.
All right.